hands are so important, and the Romantic School of Music understands how difficult it is to obtain good, unfiltered information. So I, Kevin Lee Luthier, will be sharing my anterior cervical disectomy and fusion surgery with you firsthand. I have abused my spine, and these x-rays unfortunately show what a spine looks like after diving from a high bank into a shallow river, including stray pieces of bone and, over time, large spurs. So it's time to pay the fiddler. Yet in this case, I am the fiddler. Yet with the help of a great neurosurgeon and a little more care in the future, I hope that my greatest performances are still to come. My symptoms include a numbness in the index finger and a tingling and numbness that goes across the back of my hands and up both of my arms. Anytime I lift more than just a few pounds up in front of me, it feels like someone is sinking two large knives into my back, parallel with my spine between my shoulder blades. I'm told that this is caused by the damaged vertebrae and herniated discs closing in on the spinal cord. There are always risks with surgery, but I really don't have a choice this time. So let's do it. Underneath this, I'm butt naked.
Well, my name's Debbie, and I know how to get you ready.
Yeah, they're really tight. They're called compression hose. High heels on. And there's a little hole here on purpose to check your pulse. Check capillary.
Oh yes, show us your IV.
You waiting for this room? Oh, okay.
No.
I think music's wonderful in teaching kids too. Her kids are all really smart, and I think it's because they've learned music.
There you go.
Wow. All right.
Toodaloo.
I just woke up and I'm just coming out of that really zoned feeling. Index finger is feeling really good.
My name's Denise. I'm going to be your nurse. As far as I can see, he doesn't have any restrictions.
So breakdancing tonight?
I'd probably cut that out. But
Surprisingly enough, though,
up to, but not including.
He doesn't have a brace on.
Yeah.
Advanced diet is tolerated to a regular diet. Now, the one thing we are going to make sure of is that you can pee. And we measure.
Awkward.
For you, maybe not pee here.
That's the least of your worries.
Oh, heavens.
Ooh.
I can feel where they had the catheter.
Kind of thing. They probably talk to you a lot about pain, and we always ask you on a scale of 0 to 10, what is your pain? And if I would ask that question right now, 0 being none, 10 being the absolute worst pain you've ever had in your life.
I would say I'm at a 2.
All right.
All right, about an hour after surgery, and the numbness in my finger is almost gone. I'm not feeling any numbness in the arms or hands. And sitting up, and so far so good. There's a little tightness in the throat. I'd say just a little tightness and soreness, but not bad at all. It's 3.5 hours after the surgery. My first time standing up. Everything's fine. I've had my turkey sandwich dinner with apple slices and pudding. It's about midnight, the night of the surgery. I'm still hooked up to the IV, and I have a small drainage pouch to relieve the pressure that comes from the surgery. It's almost 9 o'clock the morning after my operation. Everything's gone well. I just finished breakfast, and I'm on no pain medication whatsoever, which is surprising to me considering everything that's gone on in my throat and my spine. From what I can tell, I've had the easiest recovery from anyone I've seen on YouTube or the internet, and I have to give the credit to my doctors, Chad Cole and Judy Sampson. They're fantastic with a great attitude, and I think that goes a long way towards making my life much better, much easier. Still no numbness whatsoever in my left hand, and my right finger is gradually getting a little better each time. And now when I sit up straight in good posture, I can barely tell that there's any tingling or numbness there. And the doctors feel that even that'll go away as soon as the swelling goes down. So I consider this a fantastic success so far, and hopefully I'll be back playing again.
Are you ready?
Yeah. All right.
Okay, 1, 2, 3. That wasn't too bad.
Nope.
The ones in the belly are a lot longer and hurt a lot more.
Thank you.
See you guys.
Yeah.
Less than 24 hours later, back at home, and they tell me to keep the bandage on for a day or two and to take it easy. Probably the largest concern so far, and I can see why they suggest you not go for long car rides, is it is a whole different feeling as you rock back and forth and get jarred up and down, and we took it very slow. But part of my driveway is a long stretch of rough gravel road, and I definitely felt that. Not too bad. 2.5 days after the surgery, it's time for the bandages to come off. Let's do this properly. It's 1 week after the surgery. I've slept a lot and watched a lot of great movies in these really great tiger slippers my daughter gave me. I can get up and move around all right, as long as I don't move too quickly or bend over too far. During the first few days, make sure that all of your pillows are in place before laying down, because it's true. Even though you can walk around and sit up without much trouble, once you go to lay down, you have to support your head or you'll regret it. And if you need to reposition yourself or sit back up, your hand has to be there. leaning over too far, or attempting to get a drink after brushing your teeth. Turning too fast toward a loud noise. Instinctively swatting at a fruit fly. At a week and a half, I had a checkup and a blood test, and everything looked so good that I was allowed to go back to work after 3 weeks, on the condition that I not work more than 4 hours a day or lift more than 2 pounds, especially while bending over. I also wasn't allowed to sit at a keyboard for more than 15 minutes at a time or do any other repetitive task for more than just a few minutes. Airport security hasn't been an issue at all, but the one surprise I've had is how difficult it is to drink out of a drinking fountain. When I bend over and try to swallow, I just can't do it. At 6 weeks, I had a series of x-rays that confirmed that my spine was still healing as it should. But this is where my advice comes to an abrupt end, at least for the ordinary patient. Even though the surgery has given me back the use of my arms and hands, when I started into the stretches and exercises of physical therapy, the pain and numbness in my index finger came back. But this time, with a vengeance. It feels as though I've just jammed it into a brick wall as hard as I can. And I'm told to take long walks during the day, and I have to take large doses of oxycodone at night, just so I can sleep. My surgeon has now pulled me from physical therapy, and I'm now seeing the 4th specialist after the surgery about my finger. They've all pretty much told me that I'm going to have to live with this for the rest of my life and that violin playing isn't everything. I've also told a couple of them where to go. It's been 1 year since my spine surgery, and it's taken 23 doctors, neurosurgeons, and physical therapists 10 months to figure out all the places that the nerves to my index finger were being pinched, and to give me any hope of ever playing the violin again. It's also cost well over $100,000. My last bit of advice through all this is all doctors are not the same.